Harvard Medical School just launched an 8-week AI in healthcare program. Cost over $3,000 US. That's probably around 5,500 Aussie dollars. I had a close look at the curriculum. There's a lot of overlap with what I teach. The difference is who it's built for. And this week, that difference matters. I'm Ted Jedinak, the AI and Allied Health Guy. Still not a deepfake, still a podiatrist, still doing this every Friday. 5 things today. Stanford and Harvard's own research just proved the human in the loop is non-negotiable. The UN started formal global AI governance talks this week. Big tech clinical products are heading down under, whether you're ready or not. And if you don't know where to start, I've built something for that too. Let's get into it. Number 1, Stanford and Harvard teamed up through something they called the Arise Network. Sorry, I looked at that and I thought I saw arse spelt the Aussie way. Okay, the Arise Network and released the first proper rigorous audit of how clinical AI actually performs. Not in a lab, in practice. Now, here's the headline stat. The best performing AI models make between 12 and 15 severe clinical errors per 100 cases. The worst scored over 40. 12 to 15 severe errors per 100 cases. I've had Fridays like that. The difference is I can't publish mine in a peer-reviewed journal. Okay, look, the failure isn't in some exotic edge case. AI breaks down when it faces uncertainty, incomplete information, and multi-step decisions, which is literally what you deal with in every consultation. My entire clinical intelligence program is built on one idea. AI plus human intelligence equals clinical intelligence. The AI can do extraordinary things, but the human in the loop, that's not optional. It's the thing that makes it safe. Stanford and Harvard just peer-reviewed that argument. Save that stat, 12 to 15 severe errors per 100 cases. You'll need it next time someone tells you AI will replace clinicians. It won't, but it will replace the clinicians who refuse to work with it properly. Item number 2, the UN started global AI governance talks. Australia has no dedicated AI law. The United Nations kicked off formal global dialogue on AI governance on the 6th of July, like this week in Geneva. The World Health Organization is co-sharing the health work streams. Member states are now formally negotiating international frameworks for managing AI risk. Meanwhile, in Australia, we have no dedicated AI law. None. Zero. Australia's approach to AI regulation currently runs on our national philosophy of, no worries, she'll be right, mate. Which is fine until it isn't. What we have is a patchwork. Got TGA for devices, APRA for professional obligations, Privacy Act for data, principles-based, increasingly thin. So here's what I'm saying. Every major international jurisdiction, Europe, UK, US, now UN level, is moving toward mandatory human oversight of AI in clinical settings, which is, again, AI plus HI equals CI. Every country building an AI governance framework is essentially legislating that the human has to stay in the loop. Get ahead of it. Don't wait for the law to force you. Item number 3, Harvard charges $5,200 for this. Here's what that buys you. Harvard Medical School runs an 8-week AI in healthcare program. Executive education, online, live faculty sessions, US $3,150. That's over 5,200 Australian dollars. It's excellent, genuinely. Built for hospital C-suite executives, health system leaders, and innovators designing enterprise AI strategy. It will not tell you how to set up a scribe service before Tuesday's patients. It will not walk you through Australia's Privacy Act obligations. It will not show a solo podiatrist in regional Victoria how to build a clinic that runs without them at the centre of it. Harvard's capstone project requires you to pitch an AI-first healthcare solution to a faculty panel. Our program requires your clinic to run better by week 8. Same energy, very different Monday morning. The Clinical Intelligence Program is 8 weeks. Australian-built, allied health specific. Built for the clinic owner who has patients at 8 a.m, not board presentations at 9. If Harvard is the credential you hang on the wall, this is the thing that brings what happens inside your clinic. Item number 4, OpenAI and Microsoft are building clinical AI products. They're coming here. So 2 big announcements worth being across. In January, OpenAI launched ChatGPT for healthcare, a GPT-5 powered workspace designed specifically for clinicians and administrators. It's live in the US, doctor-led testing, integrates with patient data. In June, Microsoft announced a partnership with Mayo Clinic to co-develop a clinical AI model. The Mayo Clinic owns the model. The plan is to license it to health institutions globally. When Microsoft and Mayo Clinic say global licensing, they mean it. Australia is not as far off the radar as we'd like to think. I mean, we invented Wi-Fi. We invented the cochlear implant. They know we're here. These tools will land in your inbox as vendor emails, LinkedIn ads, conference exhibitors within the next 12 to 24 months. Your patients are going to start asking about them too. When that happens, you want to be the clinician who already knows how to evaluate them. Not the one Googling, is this TGA regulated at 11 p.m. Now, that's not a small difference. That's the difference between being ahead of your profession and being dragged along by it. Item number 5, where do I start with AI? 28th July, this is the on-ramp. All right, 5 items. This last one, it's from me. If you've just listened to those 4 and thought, Ted, that's a lot. I don't even know where to start. I hear you. We've built a course specifically for that moment. It's called Where Do I Start with AI? Pretty creative, huh? And it kicks off July 28, 2026. It's designed for allied health practitioners and clinic owners who know AI matters, but feel overwhelmed by where to actually begin. Look, no jargon, no theoretical frameworks. I'm a podiatrist. I spent 40 years explaining to people why their feet hurt. I know how to translate complicated things into language that actually makes sense. It's basically the same skill set. This is not the Clinical Intelligence Program. That's our flagship deep dive. This program is the on-ramp, the thing you do before that. If you've been waiting for a clear starting point, this is it. Link, it's in the description. All right, that's your Friday 5 for the 3rd of July. To recap, Stanford and Harvard proved AI needs human intelligence to be safe. The UN governance talk signals where the world is heading, and Australia needs to catch up. Harvard charges $5,200 for 8 weeks of AI in healthcare, and who it's actually built for. Big tech clinical tools are coming to Australia, whether you're ready or not. And if you want to get ready, where do I start with AI? That's your starting point. Grab the PDF bulletin below, all 5 items, sources, action steps, all included for you. Until next time, serve with spirit, consult with care, and if you only did one thing this week, It should be